Hello, today I'm going to show you how to run a visual field test using the Humphrey Visual Field machine. The first step is to clean off the chin rest and the forehead rest. So I'll do that right now with some alcohol. And then I also like to clean off the clicker and the patch. I'll just put that there. Okay, so before you begin the visual field test, you need to have the following information: the type of test that the doctor is ordering, the patient's first and last name, their date of birth, their gender, and their most recent glasses prescription. In this case, the patient was ordered to have a 24-2 CETA standard. So I'll just touch the screen to begin. If it's gray, I'll just touch it, which lights it up. And now I'll click 24-2. We're always going to start with the right eye. There was already a patient in here, so I will just click clear patient data because we are doing a different patient. Okay, so let's look to see if the patient has been here before on this visual field test. So I'll click recall patient data. We're always pulling from the hard drive, so I will click proceed. This patient's name is Test CC. And let's look through the list. We have Test AS, that's not her. And I can page through, even though it's alphabetical, I already know that CC is not here as I page through. Okay, so I'm going to hit the back button. I need to make a new patient file for this test patient. So I click patient name. And this is when I put in the family name. That is your last name. So our test patient's last name is Test, and I'll click enter. Their given name is their first name, and this patient's given name is Cece. Enter. Middle name, you don't have to do that, so I'll just hit enter. Prefix, I don't have to do that, so I'll skip that with enter. Same thing with suffix. Enter. Now my patient's name is there. Her date of birth is January-25-1975. Actually, I'm going to make her a little bit older. 1945. Her gender is a female. This is important because it helps with the norms that the data is compared to. Let me back out of this. So we have to put what lens they're going to look through. So I'll click trial lens. The doctor could have already told you what lens to put in, and that's when you would click manual trial lens input. If that's the case, you just type in right here exactly what the doctor told you to do. In this case, the doctor did not tell us. So I'll back out of that. I'll go back into trial lens. And we need the machine to calculate the trial lens for us. So CC Test's most recent prescription is a -9, enter, with a 3 diopter cylinder, enter, and that is at axis 180. And then her left eye is a -3, 50, enter, with a -1 cylinder. Notice how I'm putting in the minus sign before the sphere and the cylinder, and that was at axis 180 as well. So this prescription matches what her most recent glasses prescription is. Even though her glasses prescription has a +250 add, I do not have to do anything with the add. I'm only putting in the first 3 numbers. Now I will click calculate trial lens, and I need a scrap piece of paper so I know which lenses to get. For the right eye, I need -575, -3 at axis 180. So let's see. I have my lens right here. The sphere is the -575. The cylinder lens, you can tell is a cylinder because it has these red lines on it. This means that it is a minus cylinder lens. It's important that you have the right kind of lens because that can mess up the test. So since we're doing the right eye, let's put this lens in first. So we'll come over here. The trial lens holder might be down. If it is, you can just pull it up and bring it out in front. You're going to put the minus cylinder lens in first, the one with the red lines, and you want it to be lined up exactly with the marking. 180 is the same thing as 0. If the patient's axis was at 90, you would turn it like this. But today, we're at 180. And then I take the sphere lens, the one without the red lines, and I will just put that behind. Now I'll put it back, and we're ready to bring in the patient. CC test?
Yes.
Please follow me. You can have a seat right here. We are going to do this test without your glasses. Please take off your glasses. Before we begin, I'm going to put 1 drop of an artificial tear in each eye of the patient. This will help keep their eyes lubricated while they take the test. Okay, I'll be putting an artificial tear in your eye. Please put your chin up and look way up high. I will pull down on the lower lid. Without touching the tip of the bottle to the eye, I will squeeze 1 drop out. And we will do the other eye. Good. And you can close your eyes. Do you need a tissue?
Yes.
Okay, we will be testing your right eye first. Please put this patch over your left eye. Putting a patch over one of the eyes is one of the most important steps of doing a visual field test. If you don't put a patch on, then the results are invalid. You look great. Okay, I'll hand you this clicker, and this top part is where the clicking is. So hold that in your hand comfortably. I'll have you wheel up, and before we get in, I'm going to do a quick double check to make sure that the lens is exactly where I need it to be. So if we remember, right here on the screen, it says that the lens is a -575, -3 at axis 180. Let's check where this lens is. Uh-oh, that's not right. We need to turn this so it's at 180. There we go. Okay, now I'm ready to come over here and click proceed. I will move the table up or down using this up and down lever because I want the patient to be comfortable. So I'm lowering it to her height. There we go. Okay, CC test. I will have you move forward and you'll put your chin on the left side because we're testing your right eye. All right, let's raise up your chin. I'm using this keypad here to raise up her chin. And then I'm simultaneously lowering the machine so it's comfortable on her neck. We need her chin to be on the rest and her forehead to be all the way up against that bar. Now, once we look here at the video screen, her eye is way out of the target. So wherever I push on here is where her eye goes. So I need her eye to come down, so I'll click down. CC, let your head move with the chin rest. Good. Okay, and now I need her eye to go to the right, so I'll click the right button. And I'm trying to get her pupil lined up with the cross in the middle. Okay, once that's lined up, I'll ask the patient if she's comfortable. CC, are you comfortable?
Yes.
This is a long test. Can I move the machine up or down to make it more comfortable on your neck? Up or down?
A little bit up.
How is that?
Much better.
Okay, very good. So now that this is lined up, I'll make minor adjustments here and there. And I'm going to lean in and bring the trial lens holder close to her eyes. I'm bringing it as close to her eye as possible without the lens touching her eyelashes because that's more irritating. And one final adjustment. Now that we're lined up, I'm ready to give the instructions to this patient. This is what you say. We are about to do a visual field test. This test will measure your side vision. We will test one eye at a time. Your job is to look straight ahead at the fixation light the entire time. While you are looking at the fixation target, small flashes of light will flash in your side vision. If you think you see a flash of light, click the clicker. Remember to always look straight ahead. You can blink whenever you need to. You will not miss a light. Please let me know if you need to take a break. I will adjust your position throughout the test. Do you have any questions?
No.
Okay. Look straight ahead. We will begin by setting the tracking for your eye. Look straight ahead right now. And now I will click Start. Instruct patient to look at the fixation lights. We just did that. Click Start. And you can see that it's blinking on and off because it's tracking her eye, and it says it was successful. Okay, we will begin the test. And then you click Continue. And it's successful. Now the machine will start to present lights to the patient. And look at how her pupil is just out of range. I'm going to do that minor adjustment. And she's doing a great job looking straight ahead. Oh, now she's starting to move her eyes around. This is when I say, I'll pause the test. And I'll say, it's very important that you look straight ahead the entire time. Just a second ago, you were looking around a lot. Try and look straight ahead at that fixation light. If you think that you need a break, you can hold down the clicker and that will pause the test. I've paused the test right now. Are you ready to resume, or do you have any questions?
I'm ready.
She's ready. Okay, let's look straight ahead and I'll resume right now. So she has finished the test and this dialog popped up. Do you wish to save this test for this patient? Yes. Saving test in progress. You can sit back now. Great job on that test. I know that was long. You can take a quick break and please switch the patch to your other eye. It says floppy disk not present, insert floppy and retry, or press cancel. For this specific office, we're going to click cancel. And now we're going to click Test Other Eye. Now if you remember, the lens that we needed on the other eye was not the lenses that we needed for the right eye. So I'm going to go over to the trial lens holder, take out these lenses, and put in the -75 spherical lens that I had already gathered. Notice how the spherical lens does not have any red lines on it. So this can just go in any of the slots. I'll put it in. It does not matter which direction it's sliding to. And I'll put that back out there. Okay. I'll hand you your clicker back. Were you comfortable with that last test? Was there any movements I could have made to make it more comfortable for you?
No, it was comfortable.
Good. Okay. Let's make sure that patch is covering your eye completely. Okay, so for the left eye, we're going to put our chin on the right side. So put your chin down here and your forehead all the way up against that bar. Is that still a good height for your neck?
Yes.
Okay, let me adjust you just a bit. Now, if her left eye did not need any lenses, I would still take out the lenses from the right eye and I would just not put any other lenses in it. I'm still going to put the lens holder, though, close to the patient's eye. That way it's out of the way. This lens holder, if you see, there are little sensors right here that track the patient's eye moving. So it's important that we continue to keep it up close to the eye so we make sure we have a good, valid test. So I'll make sure that her eye is where it should be. Remember, the arrow is where we want her eye to move. So we need her eye up a little bit and to the left a little bit. Okay. Do you have any questions before we begin this test?
No.
We will click Start. And I'll have you look straight ahead at the fixation lights. The instructions are exactly the same as the last time. Look straight ahead. If you think you see a flash of light in your side vision, please click the clicker. It's okay to blink. You won't miss any of the flashes of light. Just click the clicker when you think you see it and look straight ahead. Any questions?
No.
Okay, look straight. We will get the fixation set on your eye. And that was successful. And we'll continue to start the test. Please note that we will do this entire thing in the dark, so room lighting should not be an issue because the overhead lights will be off the entire time. It's also important to know that you shouldn't talk during the test to distract the patient unless it's a very quick, encouraging word or to tell them to continue to look straight ahead. You're always monitoring where their pupil is, and you want that cross to be right there in the middle of the pupil. Right here on this gaze tracker, every time her eye moves, it's a tick up. Every time she blinks, it's a tick down. So we're pretty close to the center line, which means that our gaze tracking is doing well. If she makes a lot of mistakes in a row, the machine will beep at her. It'll go beep beep, and that might be a good time to pause the test, re-explain the test, and ask them if they have any questions about how the test is done. Okay, you can sit back. I'll take the clicker from you, and you can take off the patch. Click cancel. Now you're going to click the print icon. This printer will print both the right eye and the left eye. What you can do is GPA summary, or sometimes you can just click single field analysis. You will almost always do single field analysis unless your doctor says otherwise. So we'll change that to single field analysis. XX, which means yes, print the right eye, yes, print the left eye, and then you'll click print all selected items, and you will see it should come through the printer here. Printer is not connected. This means that the printer was not turned on. There is a switch right here. If you look from the front, this is the up-down button for the machine. The switch is right here. So I'll turn on the printer. And then I'll say, retry, please. And then you will see the printout come through, and you rip it up to get it out of the printer. And there you can see we have the visual field for the right eye. You know that it's the right eye because the black spot is on the right. And then we have the visual field for the left eye. You know that it's the left eye because the black spot is on the left. This is a normal black spot. The doctors really only use this bottom part, and it is not your job as a technician to interpret the test for the patient. So the patient will sometimes ask, how did I do? And your answer will always be great. So you'll thank the patient. You'll say, thank you so much for doing this test. Do you have any concerns about what you did? No. Okay. The doctor will go over this test with you soon. I'll have you wait out in the waiting area.
Thank you.
And then you'll take the printout and you'll put it in the patient chart, or you'll hand it directly to the doctor. And thank you for watching.